Hello everybody, welcome to the new series called Surgery. This is off of Series-pt1-Braces, and if you haven't noticed, I'm doing surgery for braces. Before I scrub in, the surgery may it contain graphic procedure inappropriate for children or screams adults. I don't think any adult watches me. Series-pt1-Braces is not a substitute for professional medical advice. Now, the reason I'm doing braces first is because, well, I have braces. I just got them like Monday. Yeah. Okay, let's start. Game never loads that fast. Alright.
Welcome to Surgery Squad. I'm Dr. Jeff,
Hi,
and
Jeff.
today we're going to talk about braces, those fantastic bands and wires that help straighten out crooked teeth. Let's face it, most of us do not have perfect teeth.
Yeah.
Everyone's smile is unique. Some people's teeth are just a little more out of shape than others. Your teeth might be crooked, or your upper and lower jaws might not be the same size. If your upper jaw is bigger than your lower jaw, that is called an overbite. If your lower jaw is bigger than your upper jaw, you have an underbite. Sometimes your mouth is not large enough for all your teeth. That
I
is
have
referred to as
overcrowding.
overcrowding. In all of these cases, the problem can be fixed with braces.
Yeah.
Braces are a series of brackets, wires, and bands that are used to
I
guide your
chose
teeth
blue.
back into the correct position. This improves looks, makes it easier to chew, and at times even improves speech. Our patient today has what looks to be an overbite. We want to see
Hello.
how noticeable it is. We'll start by getting a record of the current state of her teeth in many
This is
ways,
exactly what they
including
did.
x-rays, impressions, and photographs. We'll start by taking some x-rays.
About last year, they did this to me. Like, last year, I'm not even joking. Last year, they did this. They made me, like, take x-rays. Click where, yeah, okay. That's loud.
Next, we'll take an impression of the teeth. We put a special gel on the bite mold. The gel comes in lots of terrific flavors, like candy cane and chocolate cake. Can you put the mold in the mouth?
This is what they did to me as well, like, last year.
Great job! We'll have my assistant make the bottom impression. Once we have them both, we'll use the impressions to make a plaster model of the patient's teeth. Okay, we've got our impressions and x-rays, and we can see that our patient needs braces. I've also taken some photos for our before and after wall. We'll arrange an appointment for next week to put the braces in place.
This is exactly me. Except it didn't take a week. It took a year for them to, 2 years for them to finally realize that I needed braces. One
Our
week
patient is
later.
back, and we're ready to put on her braces. In some cases, a patient may need spacers placed between the teeth for a week to create more room for the bands. Our patient does not. We'll start by polishing all the teeth. Making sure there is no
Damn
debris
lips
on the
though.
teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them.
This is what they did to me as well. Let me polish your tongue really quick. Let me get your tongue really quick. Let me get your gum a little bit. And why don't I just do your entire mouth? There you go. Continue.
Wow, what a marvelous job! I can almost see myself in those teeth.
Good
We'll
for
need to
you!
put on some molar bands to anchor the braces.
I didn't have
Encircle
that.
the whole tooth and have a hook on the outside of the tooth. Slip the molar band over the tooth. We'll cement it into place later.
I didn't get that. Okay. Yeah, I don't have these. I think. I was asleep for
Great.
half the
Now we can
time.
start putting the bonded brackets on the rest of the teeth. We've placed a lid guard over the teeth to
I
give
didn't
us
get
room to
that.
work. Let's rinse off the teeth.
I
Can
didn't
you
get that.
sprinkle
I
with
got a giant
water?
mole
I'll
in
run the
my
suction to
mouth.
remove the
That hurt
water.
my tongue. What? Water rinse teeth. Okay. Let me just. Yeah. It kind of tickled me when they did this. When they had pushed the water over me, it kind of tickled. It was fun. Oh yeah, that's
Let's
the.
spray some air to get the teeth nice and dry. Can you handle that for me?
This tickled as well. It was like, no, didn't happen to you, Mom. Let me air out your entire. There you go.
With the teeth dry, we'll now put a small amount of bonding agent on the teeth. Wipe a little bonder on each one.
This is what they did to me. Oh, I don't think they used that exact tool, but they did this. But they definitely did do something like that.
We let the bonder dry for a minute or two so that it is sticky. Then we place a bonded bracket onto it.
Bracket. I can take like. Thank you. Continue.
I will scrape off the excess bonding agent with a
That's
dental
what they
pen.
did. It hurt like
Now use a
hell.
curing light to harden the bonding agent under the brackets. Click to turn on the curing light.
She did it for every single one of my teeth, but I'm just gonna do it for the corners. Cause I'm
Great
bored.
job! Now I'll put the bonded brackets on the rest of the teeth. There we are. While I was at it, I readjusted the molar bands and cemented them. We're
Okay.
ready to place the arch wires.
Okay.
The arch wire is a thin wire that connects all of the teeth by going through each bracket. Let's slip the wire into the brackets of the bands on the molars. Move the wire to the mouth to put it in place.
Oh, I accepted this. Oh. Okay. So they. Oh no, that's not how you do it.
Good job! We do not want the wires to poke our patient, so now that they are all snapped into place, I'll reduce the ends by clipping them off with pliers. And there we are. The arch
Yeah, but
wire
they
is in
hurt me
place.
like hell. I had to go
Now we'll
yesterday
use
to clip
elastic
them.
ligatures to make sure the arch wire does not fall out of the band. The ligatures are little rubber bands we
I
snap
got blue
onto the
ones.
front of the bonded bracket using a different pair of dental pliers. Now you try. Place the ligature over the brackets indicated.
I have blue ones, like the shade of my shirt that I'm wearing right now. I got those shade. The sound. Can I just click and? Oh, okay. You wanna know my number one fear? Going to school looking like an idiot. That's why I was scared to get braces. I didn't want to go to school looking like
And
an
with the
idiot.
last ligature in place, our patient is done for today. In the next few days, she might experience some initial discomfort. She should plan on eating soft foods
I
and
haven't been
taking
eating anything.
over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort. If there is a real problem, she can always call the orthodontist. It is important to take more time
I
brushing
used
and
this
flossing when
morning.
you have braces, as food can get lodged between the wires and the teeth. Our patient will have regular appointments about once a month for the next 6 months, and then space them out after that. The treatment usually takes about 1 year with braces,
I
and then
gotta take two.
additional time with a retainer. The true length will vary by patient. She
Mine's gonna
might
take
also need
2 years.
additional equipment such as elastic bands, coil springs, or headgear. We will not know until we see how she responds to the braces. There you have it. The braces are in place, and our patient is on the way to a beautiful straight smile. Thanks for coming by Surgery Squad. Why not check out one of our other
What is
procedures here on
this?
SurgerySquad.com?
Colon cancer? You have to cut that little dangly thing in the back of your throat. At least this one wasn't like where you have to cut things and you have to snip things in, you have to bam things in, like no surgery and Anyway, let me move my mouse off that before I accidentally click it. Anyway, like and subscribe if you enjoyed. I will see you guys in the next video. Thank you all for watching, and I will see you guys next time. Bye bye.